Greetings. I want to talk to you about the coronavirus. Well, the real name is COVID-19. You see, it's normal to feel vulnerable and overwhelmed as you read the news about this new infectious disease outbreak. It's important to acknowledge your feelings and to look after your physical and your mental health. Your daily living activities should not stop. Please continue to engage in your daily routine. You might want to try practicing relaxation and deep breathing techniques to help keep you calm. Continue to exercise and eat a well-balanced diet. Make sure you get plenty of quality sleep and get outdoors. Stay updated with current information from health authorities, but resist an overconsumption of news about the virus. Fear and anxiety can lead to social stigma. Stigma and discrimination can occur when people associate an infectious disease such as coronavirus with a population or a nationality, even though not everyone in that population or from that region is specifically at risk for the disease. Stigma hurts everyone by creating more fear or anger toward ordinary people instead of in the disease that is causing the problem. So if this is happening to you, talk to your mental health provider about any thoughts or actions of discrimination targeted toward a specific group. Although experiencing some anxiety is normal, in fact, it can motivate you to keep yourself safe. However, intensified feelings of overwhelm, hopelessness, increased anxiety, obsessive and depressive symptoms may require the attention of a mental health professional. Keep in mind that mental health professionals like me, we are healthcare professionals. However, we are not equipped to treat coronavirus or COVID-19. So it's important to first seek proper medical treatment if you are exhibiting any flu-like or respiratory symptoms. If you have traveled or know someone or have come in close contact with someone who recently traveled, and this does include cruise ships, if they've traveled to China, Iran, South Korea, Italy, Japan, or Hong Kong in the past 14 days, and they are exhibiting mild to severe symptoms of fever, cough, shortness of breath, then you should call your medical professional immediately. If you are currently seeking mental health services and you are also exhibiting any of the above symptoms, please request a telehealth appointment with your mental health provider. This is where you and your mental health provider can meet over the computer, as we are doing right now using video. But many mental health providers are not able to provide this, so please check in with them. Find out if they can offer video teleconferencing so that you won't have a disruption in your mental wellness plan. Now, if you want to know more information about COVID-19 or aka coronavirus, go to the CDC at www.cdc.gov, or you can check out the World Health Organization at www.who.int.